illness and issues among humans, and it has impacted several countries to go into an economic slump. In just a span of 2 decades, there have been 3 records of human coronaviruses that have been deemed as deadly. With the dreaded impacts of the current COVID-19 situation, the need to gain a deeper understanding about human health disasters is vital, timely, and necessary, especially in our society today. In this video, we will be tackling MERS-COV along with the risks, vulnerability, hazards, exposure, and precautionary measures that the people should take in order to hopefully combat the illness. MERS, otherwise known as the Middle East Respiratory Syndrome, is a respiratory illness caused by the virus that is labeled as MERS-COV. As the name suggests, it emerged from the Middle East, particularly in the country of Saudi Arabia, and it plagued 27 countries across the Arabian Peninsula, Africa, and the southern part of Asia. This virus originated from a family of large crown-shaped coronaviruses that causes the common cold and other complicated respiratory diseases. Based on the statistics provided by the World Health Organization, as of December 2020, there have been 2,566 cases of MERS-COV and a record of 882 deaths ever since its emergence in 2012.
MERS-CoV marks the second known zoonotic introduction of a coronavirus, usually originating from bats. However, there is a big probability that camels are the intermediate hosts of this virus. MERS-CoV appears to have been going around dromedary camels for 20 years, and neutralizing antibodies have been detected from these specific camels from Oman, Canary Islands, Egypt, Jordan, UAE, and Saudi Arabia. Respiratory transmission is currently considered as the route of transmission and can be detected by reverse transcription PCR, or as you all know, RT-PCR. Cases have been reported mainly among household members and healthcare workers, which suggests that transmission is through close contact. Airborne and standard contact precautions like wearing of N95 masks when around infected patients are recommended by the United States Centers for Disease Control and Prevention, or CDC. The CDC defines a confirmed case of MERS-CoV as a patient with a positive RT-PCR test. Someone who had close contact with a confirmed case is considered a probable case. The incubation period of symptoms is 2 to 14 days, and it is unknown whether or not the patients are infectious during this incubation period. The severity of symptoms varies, but it is known that MERS-CoV causes symptoms of upper and lower respiratory tract infections. However, there are several cases of asymptomatic patients who most likely had close contact with a confirmed case.
Among the sample size of confirmed cases from Saudi Arabia, men were the ones more susceptible to the infection brought about by the virus as compared to the women. Those mainly affected by the virus were adults aged 36 to 45 years old because of the amount of exposure to the outside elements. Although the ones that stand to be the most vulnerable to MERS are those part of the elderly and immunocompromised population. In instances where the patient was shown to be asymptomatic, however, there was a higher rate of women who were found positive than the men. The pervasiveness of MERS can be credited to the fact that healthy members of the population may appear as asymptomatic and act as potential carriers of the virus and infect those who are weak against the disease.
According to medical experts, the human population may be infected via direct or indirect contact by dromedaries or even camel products. Even up to this day, people are getting diagnosed with the MERS disease, especially people in the Middle East, hence the name. Due to that, the disease is affecting a lot of lives and causing some problems with their life, such as their businesses, health services, and more. Getting caught with the disease already leads to a loss in terms of their economic status and personal health. Now, we can't stop the spread of the disease, but we can mitigate it. For that to happen, we need to do a risk assessment. According to the World Health Organization, the reason for the spread is because of low awareness and doubt of having the disease. Furthermore, the vague symptoms of the disease being similar to other illnesses such as having a fever, coughing, shortness of breath, and the like, are making control over the disease much harder to isolate it, since it's hard to immediately diagnose people with the said disease, thus giving it the chance to spread like wildfire. In order to do something about it, the WHO implemented safety guidelines in battling the disease, such as immediately asking people who came from the Middle East or people who had close contact with other people who were suspects of the disease. Those people will immediately be isolated to try to contain the disease. Now, we can stop the spread of the disease. What we can do is immediately provide action in determining who is infected and who is not. Next up is vulnerability. It's only natural for people to be prone to the disease, especially when you had close contact with people who are suspects of the disease, or dromedaries, or even camel products. But there are people who are even more prone to the disease. These people are adults, medical staff, people who have health conditions such as diabetes, lung disease, and people who have weak immune system. Even more, according to medical experts, most people who died from it had pre-existing medical conditions. In order to do something about it, people must adopt to the case to make some countermeasures. An example would be a medical staff living in the Middle East. Just by being there and the nature of their job, they become more prone to the disease. And the only way to adapt to it is to strengthen infection prevention and control within their medical facilities, gain more knowledge about the disease, and properly monitor people who are suspects of the disease. On the off chance a person is infected with the disease, these tips to adaptation will help handle the disease.
MERS-COV is a natural hazard due to the nature of the virus being a physical occurring phenomena. Natural hazards are caused by the physical external forces at work, which in turn is just a result of the geographical location of a particular area. The spread of diseases, of course, classified as a natural biological hazard and is therefore something people have to regularly deal with. The risk of spreading the virus, however, is something that can be lessened by following proper protocols established by local authorities and experts in order to avoid widespread infection. This type of prevention is usually referred to as hazard mitigation. Hazards of a biological risk disaster should be taken very seriously because in an event of a local outbreak or epidemic, one can expect mortality rates to dramatically increase.
According to the CDC, the following are high risk for MERS-COV. Recent travelers from the Arabian Peninsula, people who had close contact with an ill traveler from the Arabian Peninsula, those who had close contact with a confirmed case, healthcare personnel not using recommended infection control precautions, and people with exposure to camels. To further understand the possible exposure to the said virus, a journal article on the 2014 MERS-COV outbreak in Jeddah elaborated on the close contact of people to dromedary camels. There has been increasing evidence on the transmission from camels to humans through close contact, and it could be possible that the labeled primary cases of MERS-COV are associated with zoonotic exposures, or the spreading of germs and whatnot between animals and people. These primary cases may also have resulted in secondary transmissions in households. In the study, the surge in cases back in 2014 could be explained by secondary human-to-human transmission in healthcare facilities. It was determined that the majority of patients infected with MERS-COV had exposure to other MERS-COV patients, mostly in healthcare settings. The spike in cases and its supporting evidence that it came from healthcare facilities highlights the importance of proper implementation of infection control measures to limit further transmission.
Communication plays a vital role in providing relevant information to the public that would allow them to make well-informed decisions and take all the necessary actions to protect their health and come up with safety responses. In accordance with the World Health Organization's Outbreak Communications Planning Guide, Communication should be based on these 5 principles: trust, announcing early, transparency, listening, and planning. Effective risk communication is essential because it serves as a public health tool. This planning guide has been useful in establishing a framework for effective communication in times of disease outbreaks like MERS-COV. Human health disasters are unpredictable. They could emerge from everywhere and possibly spread across different countries, which is why planning and preparing are some of the most crucial steps to ensure a specific and effective response. Before any health disasters, one must learn how diseases spread to gather sufficient knowledge and information about the transmission of different types of viruses. Alongside that, it is also important to gather emergency supplies that contain food, drinks, medicine, and all other basic necessities. This is an essential action in preparing not only in cases of human health disasters but in any type of emergency situations as well. Lastly, the habit of cleaning and disinfecting areas that are commonly used by people is also necessary to prevent the spread of germs and bacteria with or without the presence of a virus outbreak.
Since there has not been an available vaccine intended for MERS-CoV, it should be highlighted that the visiting of farms, barns, or any other areas with camels and other animals should be discouraged and avoided by the masses. This is the primary guideline that one should remember during MERS-CoV outbreak. However, with any virus that threatens to plague a nation, the general practice of good hygiene, especially the frequent hand washing and sanitizing, should always be instilled among the people. Having a small alcohol or hand sanitizer to bring along with you will help you be protected against viruses and bacteria. Along with this, the constant disinfection of the surfaces you touch is also encouraged. It should also be kept in mind to avoid sharing utensils and cutlery, especially when with sick people, and to cover your mouth with a cloth whenever one feels the need to cough or sneeze. These must all be kept in mind and be put into practice to have a safer environment that is protected from the virus.
All countries should remain cautious, especially those with travelers and migrant workers coming from the Middle East. Although there are no specific reported information that MERS-CoV has already ended, taking simple protective measures must still be continued even after the disaster to ensure the safety of the public. MERS-CoV has also highlighted the importance of removing unhygienic veterinary practices because there could be a risk of having another outbreak from the threat of zoonotic diseases. Applying all the things that were learned from the previous health disasters must remain even if there is no existing threat of a disease or virus. Avoid getting into contact with other people when you are sick except when seeking medical help. Observe proper hygienic practices and always be informed with how your local community prepares and makes timely updates for future human health emergency situations.
While MERS-CoV has distinct traits that separate it from other respiratory diseases or coronaviruses, audiences can still learn a lot from the disaster. It gives added context on how communities and countries should proceed when a new biological threat makes itself known. Areas that accommodate high-density populations are the ones most vulnerable and susceptible to the deadly viruses. Plagues and illnesses have always been a part of human history, and there is no doubt that there will be other health disasters similar to this in the near future. Before that time comes, however, individuals need to educate themselves and continue to practice caution. Learning from past threats will minimize needless panic and further infection due to the virus. Doing so will result in less outbreaks, breaches, and most importantly, lower mortality rates.